back of my head, right under the occiput, tends to be tender a lot of the time.
It's probably more on one side than the other side though, right?
I find that it's more on the right side than it is on the left side.
That's what I would have thought. Okay.
And then going down into the upper traps
Yeah.
and into the scalenes, that right side stays pretty tight.
So when it goes into here or more go back there?
Back there.
Back there?
Yep.
Okay.
Yeah, I get headaches most days.
You didn't have that before.
I clench my teeth
Yeah.
when I sleep, so I know that's a big part of it. I get the nausea with the vertigo, and the vertigo is sporadic, so I've had it for about 2 weeks this time.
Biggest thing that you feel right now?
Tension in the neck.
That's what you feel right now?
More tension in the neck. If I'm sitting still, I feel tension in the neck.
The stuff that's going down over here, you kind of feel stabbing, or like what type of pain do you feel? Like
It'll pinch. It just stays in place.
But it does cascade though, right?
It does. Goes down left side through the glute.
Okay.
And then actually sort of oddly enough skips the thigh, but then will come down through the calf and into the outer edge of the foot.
So what happens when you get more active? Like, does it start like, because you said it bothers your hip too. Does it bother your hip more, or does it bother that more, or does it bother?
Bothers the SI joint more.
Okay.
And then once this gets inflamed, then I'll start to get down the leg.
So your pelvis is rotated inwards, like I told you before, but actually you have a sacral problem too. So what happens when your sacrum pops out, like posterior on this side, it actually pokes into the nerves, right? And then so what you actually have, I actually think that's actually a bigger issue for you than actually the pelvic rotation. We have a big reading over here to the occiput. So this side definitely is posterior to this side. It's actually swollen here too. I'm gonna guess when I poke on it, it's gonna actually hurt. This sacrum is actually popped out, so it's popped out backwards, right? It's posterior that way. But if you look, it actually swirls your whole all your spinuses over to that side. So basically, what I'm gonna do is I can shift that inwards. It relieves tension actually into the hip, but up the anterior hip, but it also relieves tension down into the back too. So if you just relax over here. Good.
Ooh. Yeah. It's moving better. It's not as crunchy.
You noticed it already?
Yeah.
Good.
Yeah.
Oh, that was good.
It's not pinching. That's awesome. Just a little bit, almost at the very top,
Okay.
but not what I had before. Normally I get like halfway up and I start to feel it pinching. Oh, it feels good. Just feels looser.
Good.
Feels lighter, which is nice. Thank you so
Cool.
much.
Yeah.
Appreciate it.
My
See you.
pleasure.